Hi, my name is Dr. P.K. Clark. I'm the founder of WhiteCap Institute. This is Scott Chandler. He's a mentor with our institute. And Tom Dixon, who is to the left of me, that is also a mentor. About 12 hours ago, we started a big case using Hiossen implant system. We've never used it before. In fact, we'd never even heard of it before. And come to find out, this company is the 6th largest implant company in the world. And our criteria for implants is a subcrestally placed implant is very advantageous for us as general dentists because it allows us to put an implant in any topography and get away with it, allowing us to put it subcrestal. But in order for it to be subcrestal, it also has to have a Morse taper, and this implant system has an excellent Morse taper system. They've got a soluble blast medium surface implant with a hydroxyapatite. And in addition to that, they also have a tapered, a straight, a mini, one piece, a mini overdenture. They've just got a fabulous array of selections for us. We did a case where we took out a number of teeth on the upper arch and placed one implant per tooth, putting 14 implants in the upper arch, immediately loading it with a roundhouse temporization with a full roundhouse bridge. And then we went ahead and took teeth out on the bottom and put 9 implants in the bottom. I enjoyed what they call a lance spur, and this lance spur it's in the marketplace, but it's in the surgical kit. Not all implant systems have this pointy ability to get a purchase osteotomy going. In addition to that, in the surgical kit, not something you have to buy extra, they have this side cutting drill. And this side cutting drill saved me on a couple of situations today, and I appreciated having it in the kit. I really loved the ease and the mindless opportunity of having depth gauge at 8.5, 10, 11.5, 13, or 15. And I have to comment, I really appreciate those depths. Sometimes you jump from 10 to 13 and it's not appropriate, it's not adequate. 11.5 is a very nice depth, and I enjoyed having the depth gauges, and I think that with the exception of the 8 point, actually I think I used almost every one of them. And then you jump from there, and it's a tapered kit. I was using what Hiossen calls their HG3, which is their newest implant on the marketplace, and I found it to be absolutely fit and finish beautiful. I just applaud their product. Then you jump into from the 2, you jump into the 3.5, but it's tapered, so the end is only 2.2. And so it falls into the prior osteotomy hole very gracefully and just opens it up without any big deal. And then the same with the 3.5, 4, 4.5, 5. Let me comment on what I learned today. I just put in 23 implants in one patient. The containers that they came in were just about as user-friendly as I've ever seen. So the implants just sitting there, the insertion tool the insertion mounts mounted, the insertion tool easily fit on it. It never fell off. I've dropped many other product manufacturers on the floor. This didn't fall off. It went ahead and I could see it, and then I loved the fact that the insertion assembly extended beyond the bone level so that I could see where I was for spatial orientation, for angulation, stuff like that. And this sounds silly, but I did like the cant of the surgical kit where it was facing me. I could see into it rather than have to get on top of it to look. It comes with a ratchet for insertion, comes with a measuring device. So inside there was another tray. There was some spare measuring devices, implant trials to see how it's looking depth-wise. So that was very cool. They don't fall out. Now, if you buy an implant system and they all fall on the floor, buy another one. Take it back. Very thoughtful. And the inside, they use the container very nice. And those are kind of my feelings. Then if you got into a super wide one, which we did today, they offer a 6 millimeter diameter. Most people do, but they also offer a 7 millimeter. And I don't know if I've ever heard of an implant company offering a 7 millimeter wide implant. That comes in 7 by 7. So they allow me to work in proximity to the sinus if I don't want to get involved with that, with the shorter implant and the wider one. Their ultra-wide system piggybacks this system, and they had some trephines and some further osteotomy burrs in this ultra-wide kit.
Cortical drills.
I like the dark background with the white writing. It's easier to read. It's for some of that almond cream with black ink on it is not as easy to read. It's low reflection, so the light doesn't, it's easier to read. I really like that. I mean, I really like the open wrench that'll hold on to it. To me, if it's
you got one that's spinning.
Sure. I mean, that's a neat thing.
Just the thoughtfulness of every little aspect of the kit was very impressive. Just as an
I don't think
as
there's
an
anything
observer.
I disliked. I didn't find anything that I disliked about it.
Very impressive, just overall. As an observer, I was excited to be able to experiment and use it myself.
This was in my office within 24 hours of making that order. No mistakes in the order, and I was just overall very pleased. I felt like to place 23 implants in one patient with immediate extraction and an audience and having it foreign and doing it all within a good strong day with a little break for lunch was kind of a testament to its usability.
User-friendly.
I think it's a very well done kit. I was a little concerned. Never really bought an implant from a company that originates in Korea, and I have no problem with Koreans. I've been used to things coming out of Europe, and I've used many systems, and I have to say that the fit and finish and the ergonomics and everything was as good as any German, Swiss company I've ever used. I'm looking forward to embracing this in my teaching center. I'm looking forward to embracing it in my private practice that's limited to dental implants.